Very good evening, everybody. Meeting again in the session of Mathematics after a big gap. Mm. Today, I will going to share one of the important remedy from your fourth year syllabus, that is the Asteria Rubens. It is a fish remedy. It is starfish, which we'll going to understand in today's session from Allen's keynotes. But before going to the remedy, I will share one case and in which I have utilized Asteria Rubens and with a successful result. Asteria Rubens is generally, I have tried it in more cases of the breast cancer where ulcerative stage of the breast cancer is already started. It is very useful remedy specifically for that. I will share one screen. Only the first photograph is there with me. Mm, just what is the stage of uh, cancer, how it looks like, just go through it. This is Asteria Rubens. Keep it in your mind. This is what is Asteria Rubens. See the breast which is fully indurated with ulcers started opening up, and this has developed, and even later here the ulcers have been developed, and this case was called to be a very difficult to cure. In fact, they have said that there are no hopes in this case. This case I have treated with Asteria Rubens along with Conime as a constitutional remedy in her case. Uh, this I want to show you specifically the ulcers were started opening up over there. In that stage of breast cancer is very specifically comes under the sphere of this specific Asteria Rubens. We have in Conime, there is hard ball-like tumor. Calcarea fluor is like that. Phytoleca decandra is like that. This looks like that. It was very hard. It was having that constitution. I have used the from biochemic. I have used the Calcarea fluor Conime as a constitutional remedy, along with Asteria Rubens as a remedy of the pathology. And there was a wonderful change has happened with this case with the help of homeopathy. So this I want to share with you regarding the stage of Asteria Rubens. And Asteria works specifically where ulcer starts opening up, leaving a red area over there, and it opens as an ulcer, it discharges something, and it further grows. Generally, this stage, whenever happens, it is called to be an incurable stage of the disease. But we have a very important remedy, Asteria Rubens, for such types of cases, and we can get very good results with such disorder. So today we're going to learn regarding the Asteria Rubens from Alinsky notes. It's short remedy explained over there. Uh, if you want to learn it from Borix Mathematics, it is already mentioned, already uploaded over there in our videos with breast cancer or breast tumors. So there you can learn the boric suspect, but in this today's session, we're going to learn the Alensky nodes. So Asteria rubens is the starfish. It is a radiator. For the psychotic diathesis, first important thing, the constitution and diathesis tendency is towards the formation of tumors, growths, hardness. All those things comes under the sphere where the lymphadenopathy gets affected or lymphadenopathy is developed. This is psychotic diathesis. The patients are generally flabby with lymphatic constitution. Lymphatic constitution is the constitution where skin, nervous system, associated with lymphatics and lymph nodes gets involved. It is called as lymphatic constitution. Whenever such types of breast cancers are there, the lymph nodes are generally gets involved and ulcers have been happened. Think of the Asteria Rubens as the first remedy. Irritable temperament, and these are very sensitive ladies which generally react very immediately hot. They are hot tempered, short tempered, irritable, and that's why they immediately react to anything, whatever is said to them. Easily excited by any emotion. That is what is the reaction with this. And same thing has happened while developing this such pathology. especially by contradiction. So if someone contradicts and this gets affected, very sensitive to the contradiction, and they easily gets excited, like anacardium, like conam. Conam comes very close to it. Conam is having the similar type of constitution, similar type of psychotic diathesis. Hit of the head as if surrounded by hot air. So head is quite hot, and it patient feels that there is head is surrounded by hot air. Sanguinous congestion of the brain. So there is a lot of congestion, bloody congestion to the brain, because of which the headache is there. It feels hot. Apoplexy. It is a pre-paralytic condition or paralytic condition because of congestion of the brain. Face is red, pulse is hard, full and frequent. So pulse is full, hard, bound. It is looks like belladonna, like the congestion is there. It is like apoplexy, like belladonna. So belladonna is one of the remedy one should compare, but belladonna is having a very acute miasm. This remedy is having the chronic psychotic miasm in background. Next two paragraphs are very, very essential, and one must understand every word from it. It is a cancer of mammary, acute lancinating pain. So it never remains in one place. They are continuously happening again and again. In Marathi, chamka niktar. Drawing pain in breast. It has been as impulsed by someone. That is swollen. It is distended. As before menses, breast feels drawn in. So that drawnness is there always because it is a heart tumor which is adherent to the chest wall, and which is not movable, and it is fixed, and it pulls up whole breast. That is the breast feels drawn up. A livid red spot appeared, broke and discharged. Gradually invaded the entire breast. Very fetid odor. Edges, they are pale, elevated, mammillary, hard, inverted. Bottom is covered with reddish granulation. So the picture which I have shared with you is very close to it. It is very clear cut picture. You can find it out over there. Yes, again I will show you the same. That see the pictures. Picture is looking like that, and this is very specific indication where Asteria remains in your mind. So this is the picture which one should not forget regarding the Asteria Rubens. Gait is unsteady, muscles refuse to obey the will like gelsemium, like alumina. So patient gets exhausted and their muscles are weak. They never, patient wants to feel go somewhere or they wants to move, but muscles they are so much disturbed, weak. Epilepsy, it is another important indication for which Asteria is good remedy. Twitching over whole body 4 or 5 days before the attack. So aura starts with the twitching. It remains for 4 to 5 days, and patient knows that she will or he will going to get epileptic attack. This is also good remedy for constipation as well as diarrhea. Constipation, there is obstinate constipation, ineffectual desire. Stools are very hard. They are round ball like an olives. So stools are more commonly looks like towards the bryonia. Diarrhea, opposite state of constipation, watery, brown, gushing out. Gushing out diarrhea is crotonti, gratiola, then gambogia, the jatropa, the thuja. So gushing out in a violent jet. So these are the remedy one should compare with it, but this remedy is very specifically psychotic. That's what we have to keep in our mind. Sexual desire is increased in women like Lilium tigrinum. So here it is opposite to the sepia at this level. Relationship similar to murex and sepia, but here specifically sexual desire. In sepia it is opposite. There is indifference towards the sex. Here it is more desire. Compare carboanimalis, conium, silicea in mammary cancer. Carboanimalis is it is a pains of cancer are very characteristically covered, but here in carboanimalis, such types of ulcerative stage never you can get. Conium, it is hard, very hard swelling which you can get. In suppurative stages specifically, the silicea plays the vital role. Then rest of the remedies which you can compare specifically in epilepsy, the belladonna, the calcarea, the sulfur specifically in epilepsy. So this is a wonderful remedy, especially for breast cancer where ulcerative stage is involved and associated with lymphadenopathy or lymphatic involvement. Think of Asteria rubens, and you can repeat this remedy. If you have LM potency, well and good. If you don't have, start with low 6 or 30 and repeat it. So one of the important remedy from fourth year syllabus, that is Asteria rubens, should be there in your mind regarding the breast problems. So that's all for today. We'll meet tomorrow again with some more remedies. So thank you being there.
Sir,
Hello.
sir, I have one question.
Yes, Amit.
Sir, in synthesis repertory, the fear of cancer is the only medicine is Asterias. Can you please elaborate in that?
Don't go with that only. That is not only the remedy. There are many remedies for fear of cancers.
Arsenic.
There are many
Okay.
more remedies. That is the limitation with the repertory you are using. There are many remedies for fear of cancer.
Okay, sir. Okay, sir. And sir, what about the foul smell in a cancer patient?
Foul.
What we can think of? Foul smell.
Foul smell
Odor.
is because of secondary degeneration which happens. The degeneration necrosis is there with slough. And if secondary bacterial infection happens over there, it always produces foul smell. It is very dangerous, very offensive. If it opens up, very dangerous smell is there.
Okay, sir. And sir, anything you can suggest for that,
Yes.
Anything you can suggest for that foul smell,
So this is a good remedy. This remedy itself
Ah,
has a odor, offensive odor in ulcerative stage.
okay, sir. And without oxidative stress, sir, anything?
Then there are many more remedies. Then conime is there, phytolacca decandra is there, many more. Calcarea fluor I used to use at biochemic regularly.
Okay, sir. Okay. Thank you
Hello,
very much,
sir.
sir. Thank you very much.
Yes.
Hello, sir.
Hmm?
Sir, is there any role of homeopathy in CRVO, means central retinal vein obstruction?
You should not take this case according to the diagnosis. Basically, it is an
No,
end
sir.
product and name given to the disease. You don't have to
Yes, sir.
treat that pathology. You have to treat the individual. You find it out remedy for the patient and prescribe for the patient.
Start with LM, sir. Na?
No, it depends. It
0 by
depends upon
2,
the case.
4%.
It depends upon case. You should not fix it that you must give the LF. No.
Actually,
Hmm?
she is 48 years of age patient, and since 2022 she becomes blind, vision is lost her.
Okay.
मग ते रिलेटिव्ह मला विचारत म्हणजे कारण तिची मुलगी वगैरे ती माझ्याकडे होमिओपॅथिकच घेते सगळ्या ह्याच्यासाठी
Hmm.
ऍक्यूट साठी पण.
Hmm.
मग तेव्हा ती मला म्हणत होती की आपण करूया का आईसाठी प्रयत्न कराल काय. ओके म्हटलं बघूया आपण घेऊन हिस्ट्री घेईन मी आधी.
You start whatever may be the constitutional remedy, and that remedy will be useful. Don't go on diagnosis.
ओके.
Hmm.
नो सर. हा नाही
Yes.
सर. चालेल. थँक्यू सर.
So thank you and good night. We'll meet tomorrow.
Thank you, sir. Good night.
Good night.
Thank you, sir.